Okay, welcome everybody. Let's get started. Welcome to this learning event hosted by Apt Associates. Yes, we can, strategies for raising compensation for the childcare workforce. We're happy to have you join us for about the next hour and 15 minutes or so. My name's David Kaz and I'm a principal with Apt and we'll be facilitating this part of the conversation. Next slide, please. So just some webinar basics. I believe everyone should be muted, but just in case, if you can make sure you're muted throughout the presentation. If you have any technical issues, you can enter them in the chat and someone will work with you to resolve those issues. We will have about 15 minutes or so for questions at the end of the webinar, and we will take those via chat so you can enter them as they occur to you. And if they are directed to a specific speaker, you can indicate that in the chat as well to make sure that we get it to the right person. We are recording the webinar so that we can make it available to everyone later, along with a copy of the PowerPoint. Next slide, please. So today we have some exciting presentations by Apt, as well as a very exciting panel. And the topics that are going to be covered are here. What are the challenges to attracting and retaining early care and education workers? What are the wage and advancement trajectories for workers within EC occupations, and how do they differ by gender and race ethnicity? What are the promising strategies for improving compensation for the EC workforce? And how can you lay the groundwork for the adoption of similar strategies in your state, county, or city? And I want to mention that we cannot get to all the interesting topics we could be talking about with regard to the EC workforce. So we are going to ask you at the end in a poll question what else we can provide you in terms of future learning opportunities. And we will connect you to a lot of resources that you can read and refer to. Next slide, please. So before we dive in, we have a poll question for you, and we're going to put the poll question in the chat. So if you go to your chat there on the right, there's a link in there from Lauren, and if you click on that, that will take you to the Slido application. It will pop up in your browser, and you're going to see this first question when you get there. What strategies have you been a part of to raise EC worker compensation? And you'll see some boxes. You can check all that apply. If you haven't been part of any strategies, you can just leave it blank. So let's give you about a minute or so to do that. You'll see on your application, once you enter your answers, you can hit enter at the bottom. And then when you're done with that, you can come back to the WebEx application. So answers are coming in. In about 20 more seconds here.
Sure thing.
Okay, it looks like people are done. So it looks like the top strategy that people have been a part of providing research and data. Some people have been a part of strategies involving bonuses as part of ARPA funding. So real interesting results there. So let's go to close the poll and we'll go to our next slide here. So I'd like to introduce our presenters today, beginning with the Apt team, which includes Adele Robinson, Principal, and Dina Schwartz, Senior Associate. Apt is a global consulting and research firm that combines data and bold thinking to improve the quality of people's lives, including a significant body of work researching, evaluating, and providing technical assistance in the workforce and economic mobility arena. Next slide. And now our amazing panel of experts. We have Beth Bai, who was appointed as Commissioner for the Connecticut Office of Early Childhood, or OEC, in January 2019. Beth, who served in Connecticut's Senate from 2011 to 2019 and in the House from 2007 through 2010, leads this office created in 2013 to coordinate and enhance various early childhood development programs and create a cohesive early care system. In 2013, Senator Bai led the effort to create OEC, one of the first such offices in the country. Her work as champion for the creation of of the office is informed by her long-term experience since 1980 as an early childhood professional. And we also have Kimberly Perry. Kim is a former teacher turned lobbyist, and her work has driven critical policy change to improve the lives of nearly 30 million children and families across the globe. As DC Action for Children's Executive Director, she has set a vision to achieve race equity in child policy and break down structural barriers that stand in the way of all kids reaching their full potential. Kim brings more than 20 years of experience as an advocate for children and families and is most well known as founding director of DC Hunger Solutions, vice president of the Clinton Foundation's Alliance for a Healthier Generation, and executive director of DC Vote. So I'm excited to hear from them. And now I'm going to turn it over to my colleague, Dina, to start APP's presentation. Dina?
Thank you, David, and thank you everyone for joining us this afternoon. First, I want to note that I approached this work from a little bit of a different perspective from my co-presenters who are experts in early childhood education. My area of expertise is in workforce development and economic mobility research, looking at what kinds of services and programs lead to increased earnings in the long term, and how we can meet the needs of various sectors to have a qualified workforce. I'm going to talk today about one project in particular that APT did for the Department of Labor's Chief Evaluation Office, where we were exploring what we could learn from workers' real-world occupational experiences to better inform training approaches. And I'm going to highlight a few things that this perspective of following workers over time can tell us about the early childhood workforce in particular, and some of the issues our other panelists will be discussing today, as well as where we might want to go with data in the future to support equitable compensation. Next slide. So for this project, the Career Trajectories and Occupational Transition Study, we put together a data set that followed workers over 10 years after they started in a given occupation. And we took all of that data and put it in an interactive dashboard that Lauren is going to link to in the chat. And I encourage you all to click through it after the presentation or even during. A few caveats. I want to point out that there are some data limitations related to how the Bureau of Labor Statistics groups occupations that aren't quite as fine-grained as we might want from a policy perspective. Things like grouping preschool and kindergarten teachers together, for example. The timing of the data is also, we wanted to cover workers over their 10-year trajectory and needed time then for the surveys to be completed. So this data set represents workers from 1998 to 2018, so pre-pandemic. Next slide. The first thing I want to show you is the scatter plot, which shows the comparisons of starting wages and wage growth occupations for all of the occupations in our data set. So these are all mid-level occupations that require more than a high school diploma, but less than a four-year college degree. And early childhood education occupations are marked in red. The starting wage comparisons are on the x-axis at the bottom. So the occupations with higher starting wages are farther to the right. The wage growth comparisons are on the vertical axis, so occupations with higher wage growth over time are further up in the chart in the purple section. So when we're thinking about wage advancement over time, the occupations in the top right corner are kind of the ideal combination of having both high starting wages and high wage growth. And they'll lead to the highest long run wage growth for entrance to those occupations. But it's also important to look at jobs in the top left quadrant. Those are jobs where someone might start out at a lower wage, but those workers do tend to see relatively higher wage growth over time. And you can see that many of the education and childcare occupations are in that quadrant. They have relatively lower starting wages, but rank higher on wage growth. Some of this is because it's a bit easier to see wage growth when you're starting from a lower wage to begin with, but still it does suggest that workers do see some mobility on average. And I do think it's important though to remember that this is wage growth for everyone who starts in that job, whether they stayed in that job or even in the field or whether they moved on to another field. Next slide. So this is a slide that kind of builds on that, where do workers go after they start in jobs? We pulled out two occupations from the dashboard, childcare workers and teacher assistants. And taken as a whole, you can see that the data shows that though A slightly higher percentage of childcare workers are still in that role after 10 years. If you look at that third row, it's pretty low for both occupations. And in general, teacher assistants are more often still in the field 10 years later, which you can see both from that percentage in the last row of 30% compared to 14%. But you can also see that the most common next jobs are more commonly in education. Often when childcare workers move on, it's outside of the field. Next slide. Another thing that we've seen that is important throughout the occupations we look at is to look at wage disparities within the field. So this, what we're looking at here is if two people start in the same occupation at a similar wage, in 10 years, how comparable are their wages? Because we have a lot to cover this hour, I'm not going to walk through all the points on the chart. But basically, if you look at the difference between two dots in the same grouping or color category, like these blue dots, that shows you the difference in average wages 10 years later. And again, these are two people who start at the same point. So 10 years later, men on average in early care and education are earning $6.75 per hour more than women, and white workers are earning $3.80 more than Black workers. And this might have to do with what those next jobs are that they take, but also whether they are receiving promotions and wage increases along the way. Next slide. So the previous slides outlined some of what we can understand based on longitudinal data of workers' career pathways that we have available today in the dashboard we linked to. But I also want to talk a bit about what future research could tell us if we were able to invest in more robust data sets and potentially add in data that is specific to the early care and education field. The big takeaway of this first bullet point is that there are many other data sources out there, including some specific sources like workforce registries in the ECE field and ECE specific surveys of workers. And those would probably be especially helpful for drawing comparisons between ECE occupations. They wouldn't have the limitations of the BLS data that kind of groups occupations in big categories. But they wouldn't tell us as much about who is leaving the field and where they're going. For that, we could potentially get information from building out much larger data sets, such as using the LEHD data, which integrates census data and unemployment insurance data, or even using IRS data. We're also in the era of big data, and there are companies that use data that's culled from resumes to look at how workers advance and which jobs they take. Though much of that's proprietary, it could also be an important source. And why would we want to do that? Well, because doing so would allow us to learn more about how workers are currently moving between jobs within the field and how that affects their wages and likelihood of staying in the field, as well as how those movements differ for workers of different races and ethnic backgrounds. And that in turn could allow us to explore how different policy actions might affect compensation and how they might affect equitable compensation throughout the field. And with that, I will turn things over to Adele.
Hi, Dina. Thank you so much. And it's wonderful to see this kind of research at the national level. And of course, we can support you in doing this research at your state and local jurisdiction too, to get more finite information that will help you with your strategies. I will turn us now to our two incredible panelists, Kimberly Perry and Beth Bai, who will talk to us about successful strategies in DC and Connecticut. And we know that there are a lot of great strategies that are going on, approaches around the country. You saw some of those in the poll, but we wanted to highlight these as ones that are really sustainable salary strategies, not just bonus strategies, and that they are taking into account issues of equity, the stratification that we often see within our workforce in their compensation as well. So let's turn to them to learn more about this important work. We will be focusing on childcare today. We do recognize that Head Start is also underpaid for all of its staff, and that their work is equally as important as childcare workers. But today we'll be focusing primarily on them. So if I could turn it now to the next slide. So just to give you a sense of where we're going, in DC, we have the Early Childhood Pay Equity Fund, which is now shifting from a direct payment to a payroll funding formula, as well as they have healthcare for all and other features. Next slide. So some of those we just want to highlight for you. We don't really have a lot of time to get into the explanation of how these work. There are links at the ending slides for you to connect and learn more, and of course reach out to our panelists. But you can see here that DC is using a wealth tax as its revenue. It started with direct payments. It's now shifting to a payroll formula 2 programs that includes a base amount, an administrative enhancement, and an equity adjustment, and that they're also mirroring a new wage schedule on the public schools. They're reaching comparability, if not parity. Next slide. And there are successful campaigns in Connecticut as well. They're moving forward. The wage supports phase 2, as you can see here, also has a formula of payments that are going to providers and being used specifically for raising compensation. And Connecticut also is working on a wage schedule. Next slide. So a little more about those. You can learn about the wage supports phase 2, also a base amount, and the other indicators different than DC about how they determine the formula. Next slide. So I want to turn it now to our fabulous policy leaders in the field. We do have time for question and answers, so keep putting those in the chat, and David will be able to go through them as we go forward. So welcome to Beth Bai and Kim Terry. It's so great to see you. Kim, I'm going to start with you. There are a lot of decisions that have to be made about who gets compensated if it's not universal. And how did DC approach who you would first decide to raise compensation for? And we know that you're also shifting it about how people are getting paid. Can you give us a little more about how those decisions were made?
I can, and I'm hoping you can hear me okay. Yes?
Yes.
All right. Our DC Council actually established an early educator compensation task force. And that task force was made up of providers, teachers, academics, policy folks, and ultimately there was acknowledgement that we were losing teachers, that we were losing teachers to non-teaching jobs. They were going to Amazon and Target. And believe it or not, folks might think that may not sound so appealing, but what they were looking for was higher pay and benefits. And we thought that's just insane, because our public school teachers, of course, make $30,000 more, are part of a union, and also enjoy health benefits. And so the task force really prioritized teachers, but they made very clear that we would eventually also need to address the pay of program directors and other staff in early education programs. So that is why DC started the compensation program with teachers. And the other piece that went into effect along with the additional pay was health, dental, and vision benefits, but actually not just for teachers, for anyone who works in an early learning program. Again, because the task force had that vision to ensure that everyone could enjoy the benefits. You mentioned the wealth tax. We did a tax on income earners making $250,000 a year or more. And that was able to cover compensation for teachers as well as health benefits for everyone in the early learning, in an early learning program. Did that answer your question okay, Adele?
Sure. No, fabulous. So the notion of a task force and the input of people from the field, as well as the usual policy wonks that are all over DC, of course. Beth, your wage supports program is being distributed through programs, but primarily for teachers and teacher assistants, I think, and maybe family childcare. Can you talk about how you chose who you would cover as you initiated this strategy?
Sure, sure. Kim, it's so nice to be on a call with you. The whole field has been watching your work in DC and learning so much. And Adele, decades of work together on worthy wages and trying to get this workforce what it deserves. And I think we should just all pause and just remember what early childhood providers did at a time that was so scary, which is what led to sort of this idea of bonuses in Connecticut. Anyway, our governor had this idea that the frontline workers needed to be rewarded. And we really gave out compensation supports two-way. One, we used our ARPA stabilization funding to programs. We sent that to programs, and they had to give 25% of those funds in the form of compensation, and they had full control over that. And like him, I think in Connecticut, we had some guiding principles, but one was that we knew we were better when we listened and we took feedback. So whatever we did, we went out, we put a proposal out there, we got feedback, we fixed it a bit, and went back out, got a little more feedback. It ended up being pretty iterative, because we really felt that COVID did not hit communities equally. And we wanted to make sure equity was at the center, and the feedback from others really helped. So at first we said, you get the stabilization dollars, but 25% has to go to staff. And we were, I bet Kim experiences too, we were an agency that didn't get any bigger and had to get all these dollars out to 4,000 teachers and teacher assistants and, and family childcare homes. That's just thousands of businesses we had to get. Well, it was 40,000 teachers, but it was more like 4,000 programs. So this bureaucracy is not built to do that. So we had some guiding principles that were: listen, keep equity at the center, keep it simple. We're not so good at that in bureaucracy, and give providers the benefit of the doubt. And those were sort of our guiding principles as we delivered this. We believed all program staff needed help. And so, Adele, yes, some went to teachers, but really these bonuses were for all full-time workers in childcare programs. It could be the person at the desk greeting parents, could be the cook in the kitchen, but that everybody is underpaid and that our wage supports program supports everyone. So the ARPA was a very simple, here's your money. About 27 million went to the compensation part. In Connecticut, we are a state of about a little over 3 million, 3.2 million people, for those of you in other states trying to think how much money is $27 million. But we also did some prioritizing. So programs that were in high social vulnerability index census tracts got more money. And programs that served infants and toddlers got a little more money. Programs that were accredited got more funding. And this was to make sure we didn't lose supply in areas where we already had low supply and that had been hard hit. So we couldn't afford to lose high quality spaces in places that were already struggling with enough to have enough childcare. So that's how that part worked. I don't know. I was going to get into the wage support specifically in the next question, that overarching with ARPA, and then I'm happy to get into the wage supports, which are going on now, that are built into the general. So that was one-time funding. Now these funds were built into our state budget, and I'll talk about that in the next question, if that's okay.
That's great. And I think what's interesting about both is how you start with almost like a bonus, a wage supplement. And now you're building to something in more of a formula. And in fact, Kim will talk about, in DC, it's actually called the payroll formula, that takes into account criteria. So Kim, can you talk about that shift that we're going through in DC now, from directly sending some money to the individual to this payroll formula, and the fact that it's got, you have a different approach to the equity than Connecticut does, and it'd be good to hear about that, and where that money's going to keep coming from, and how sustainable you think it is.
That's such a good question. So as I mentioned, when we did our compensation program, we had to do it in 2 phases. The state agency really needed time to get to stand up a permanent program. And so that is why we chose to do the cash payments directly to teachers in the first year. They hired a vendor to do it, Aid Kit, who did a great job, primarily chosen because they had the ability to provide cash payments to the unbanked. So as I mentioned in the chat with someone, the first phase was successful in our minds because 95% of teachers actually did receive their direct cash payments. And I want to remind folks that the way we did it is we did assistant teachers at $10,000 and lead teachers at $14,000. And we did it in 2 rounds. So they were eligible for the first round in the summer, or excuse me, fall of 2022, and then the beginning of 2023. That gave an entire year to the state agency to stand up the permanent program, which is just now rolling out. It will begin October 1. And this time, though, the funding will not go directly to teachers. It'll go directly to the employer. And then that compensation increase, oh gosh. That compensation increase will go directly into their paychecks. Oh my gosh, so sorry.
Little IT issues today.
Okay, having some technical issues here. So that extra pay will go directly into their paychecks. And yes, we were very concerned about the financial stability, and I think the business model of programs that serve our most vulnerable kids and families who are often on the margins. And so we did set an equity adjustment. So programs will receive an additional amount of dollars to go into their admin based on the number of subsidy children or subsidy seats that they have in their program. And that allows them to provide additional wraparound services. Perhaps it's to adjust the salary of other staff. As we mentioned before, we all know eventually we've got to get to those other staff. Or perhaps it goes to supplement or add to the pay of the director. So again, eye on the prize. Long term really is trying to raise and adjust the salaries of every single worker in an early learning program. That's the only way I believe we are going to keep our workers. We're going to make sure people feel seen and appreciated for the important work they do every day. And, you know, we were so proud of the tax increase to pay for this. But man, state budgeting is full of surprises. This year's legislative session and budget, we found ourselves fighting for some really minor cuts that were already made to the program, not because the program isn't working, but only because the executive was trying to balance her budget. And some of the funds were not yet utilized because the program isn't off the ground yet. But we fought really hard for those dollars, and there will be enough in the fund to pay every single teacher who has the credentials, the years of experience, and is eligible to receive that permanent pay.
Yeah, I mean, this is the problem of early childhood funding is you've got to be constantly keeping your hands on it and not seeing it walk away. I know that you said, Beth, you started with your ARPA stabilization fund, but now you've got state dollars coming in.
Yeah.
So tell us how that's going. And you're using a different way. You're using through rates, I think. You're increasing the compensation through a rate strategy, which is different than DC. How's that going to happen?
Yeah, really great question. So we moved, and like Kim, our goal was, at first we had to get the funds out fast. The programs were in trouble. You know, they didn't know if they were going to survive. They needed to pay their staff. And so just sending it out through the programs, give 25% to staff, worked pretty well. But then we really took stock and took time to say, what could we have done better? And I really have to, Adele, you would have been so proud of the early childhood advocates in Connecticut, because they're the ones who really pushed for the $70 million to be added to the state budget, 50 million permanent, 20 million carry forward. And they were highly effective, and they wanted the dollars to go to the teachers. And their goal was, you know, let's figure out how to get $1 an hour more for everyone across the state. But the needs across the state aren't exactly the same. and also getting funding out to 36 to 40,000 staff members is not so simple. But we did, we are in the midst of the second round of a payment. Every staff member, teacher assistant that was full-time got 1,000 in the first payment mid-year, and now are getting 1,700 each end of year as wage supports versus getting in their payroll. Kim, I can't wait to hear more about that. I hope there's some questions about that, because that's complicated. Again, we had one fiscal year to get this out. So we were able to do that. But in the first round, we only gave a 10% admin fee. And you heard Kim talk about the administration by the programs. We moved that up to 18%. And also, like Kim, we put aside a certain amount. We gave a bonus, a 25% bonus of whatever their total was for that 1,700 per staff member. And there was a lesser amount for part-time. And that gets a little complicated, but say you gave out 50,000 in wage supports, you would have gotten 12,500 that the director could use for healthcare, for bonuses, had to go toward compensation, but they said we needed a little more flexibility. But the first round, the teacher said we wanted the money coming all to us in the way we wanted. So the second time was both. It was a combination of this much programs, you have to pay every teacher this much, but then in the second phase, you also get some administrative funds, both for high need communities, and then also if they got all their teachers in our registry, because we have very little good data about the staff and what they're making, what their degrees are. So we've gone from having, 30% of teachers in the registry to many, many more. We don't have the exact percentage because the information's still coming in, but now almost all programs have their teachers in the registry. To your point, Adele, as a long-term strategy, we need to understand the workforce. And then because this was put in the permanent budget, we've been both negotiating with SEIU and looking at our rates as a state, both our state-funded childcare and the subsidy. And subsidy rates will go up 10% a year for the next 3 years for all licensed centers and family childcare homes. And for our state-funded programs, last year, the governor increased the pay for infant toddler care from the state to the program by 50%, from about little under 9,000 to 13,500. And so when you have 50 to 70 million built into the budget last year for the wage supports that were one time, and the language was this is one time, it created space for us to permanently increase the rates for both subsidy and state funded programs to help programs have something reliable. Like the directors would say, I can't build a bonus into my budget when I go to my board. This is one-time funding. So now that gives them the tools they need, because they're really struggling with workforce and with hiring, as you know, that's the big problem. So still in the second round, like we had done with ARPA, we advantaged high need, we advantaged accredited. If you worked in an accredited program or you worked with infants and toddlers, you got a higher bonus, because programs are having a much harder time with workforce in our cities in Connecticut, and also having a hard time hiring and keeping infant toddler teachers. So they got a little extra if they worked in accredited programs or with infant toddlers, or if they took state subsidy. Because we did find, even though SVI has been a great tool and the feedback has been good, the Social Vulnerability Index uses 15 characteristics of a community to talk about needs. So it's not just income. There are other important factors for families, but there were programs not in high SVI communities who were serving a lot of children on subsidy. So in both cases, we found ways to advantage them as well. So it was a simple structure. And the other thing I should say, and Kim, I'm sure you run into this, is that to keep it simple, we didn't make them fill out complicated applications. If you're licensed, we will use all the data in our system. We know if you're accredited, we know if you're taking kids on subsidy, we know if you're licensed, we know what SVI community you're in, And so programs just had to attest that they would use the money a certain way, and they could fill out the form in less than 15 minutes. It took longer if they had to put it on the wage supports where they had to put every staff member in. But in terms of keep it simple, give programs a benefit of the doubt, we learned things that are going to carry us forever as an agency, because for peanuts, we ask programs to jump through so many hoops. And we learned through this process that we could keep it simpler. We could keep equity at the center. And there was one other piece I was going to say, but I forget. So anyway, that's our story with it being built in permanently to the rates. But now we have to see, will that bring the pay up? Because I've talked to other commissioners where they've been able to increase the rates, but the wages didn't come up proportionally to the rate increase. So we'll be looking carefully at that. And now, because we gave the bonus to get them in the registry, we'll have a tool to do that.
So Kim, I see you nodding. It's really interesting to me, the similarities of taking into account how hard it can be to get this money out and what are your mechanisms to do it, and making sure it actually gets there, and the data component that you need so that you know it's actually getting to the people. I'm sure you're doing some contract work in both places for accountability to make sure it goes where you want it to go. And we keep our fingers crossed for the sustaining of your funds and the growth of your funds, frankly, not just sustaining your funds. I'm going to switch a little bit because there's been a lot of conversation around the country about wage schedules. And a lot of states and localities are looking at wage schedules, preparing wage schedules. They're almost entirely really just for teachers and teacher assistants. Hard to just implement. I know both of your wage support programs, the Pay Equity Fund, are tagging a minimum salary, not minimum wage, minimum salary that you're pegging to get close to parity. But on the wage schedule, what's been your process for that, and how do you anticipate it getting used? And either of you could start with that.
Well, we had a legislator who was an early childhood provider, and he made us. He said, you have to do a compensation schedule, and we want you to take into account the level of education and training, the employment experience in early childhood, use certified teachers as your sort of comparison, and the cost of living in your part of the state. And so we approached this work working with UConn economists, because, you know, from the first presentation, I think anyone that's worked on this kind of wage work figures out very quickly that it's super complicated. And so UConn partnered with us, and we landed on a compensation schedule that goes from, in Connecticut, and cost of living in Connecticut's usually in the top 5 in the country, but from $34,000 for level 1 to $64,000 for level 5, which would be a master's level, almost $65,000. And a BA would be 56, an AA 45, and a CDA 39. Now, we are really looking at, and I urge others on the call to think about this, making that 3 levels with a wider range to align with the unifying framework, because we just can't do this to teachers anymore, where they move from state to state and now their credential means nothing. And I think we've all got to get on board with the unifying framework after all the hard work that was done to get everyone on board with that. So the governor has appointed a blue ribbon panel, which is spending a year studying early childhood and coming up with recommendations next year. And the workforce has been at the center of that work to date. And so we came up with these 5 levels that will shift to 3. But we've used this and worked with, and another suggestion to others out there, we had a management consulting firm in Connecticut who offered both to help us measure unmet need and then develop a financing tool. So our state has a tool to know, what would it cost to do this? What if we do that? And the wage scale was built into that. So what would it cost if we paid everyone on this wage scale for an early childhood system? So it can be used at a macro level to sort of cost out the system in Connecticut, and to help this blue ribbon panel make recommendations and then look at the costs of various recommendations. So I really recommend finding out if you have a management consulting firm in your city or town, if they'll do pro bono work, because to have complete outsiders come and look at your system for 10 weeks compared to what a bureaucracy can do looking at its own data, they just come at it with a new lens and a new point of view. And we think the combination of having this wage scale and having a financing tool that looks at from your smallest family childcare to a very large center, what are the real costs of high quality care, is going to help us as a state make a long-term plan, because Governor Lamont has asked us to look at a 5 to 10-year plan for childcare. You know, just like you may think, oh, we just need to put rates up 30%. But we've really said we're going 10% a year because the families who are paying full fare, if we put the rates up 10%, that provider can only take that 10% if they charge what that 10% increase is. And so that means the full pay parents have to come up 10%. So we tend to be very provider focused, but I think we've also got to sometimes back away and look at the impact on families. And as we make these needed changes, either that or change the federal rules. But right now, that's why we're going 10% a year instead of a quick jump in Connecticut, to make sure that it's staged over time. And the parents who just miss qualifying for subsidy, which is a whole lot in Connecticut, still can't afford childcare, that their rates don't go up. So that's how we're using it. But I'd love to hear, Kim, what you're doing with it in DC.
So interesting. So we went a completely different route. As ours starts with the task force, but actually maybe it goes back a little bit before that. So the workforce piece that we're outlining here was part of the Birth to Three law, which is a piece of legislation that was passed in 2018 to provide really a blueprint for how we would provide more public financing and more support for infant toddler care. And so part of that was built in pay equity for teachers, equivalent to that in the public school sector. So the early educator task force really started there, and they developed a draft pay scale based off of, so similar steps as to the public school system. But the cost of living here is really high. Our public schools
Even
are
higher than us. I have a
even,
daughter who lives in DC.
I think we're all, yeah, I was like, we probably all are on the same level. It's very expensive. And so this is though what makes it transformative, because our teachers here do collective bargaining and are unionized, their salaries are much higher. And so because we put in the law parity with public school teachers, it jumped. So an average early educator in the district was making, as you said, Beth, about $34,000 a year. Guess what they now will be bumped up to? I don't have our scale in front of us, but the lowest, I think, or the starting is $75,000
Wow.
now. It originally was $63,000. And then the public school teachers renegotiated their contract. And so that scale is much higher. It too is based on degree or credential and years of experience. It has a lot more steps than I think anybody really wanted. But again, it was trying to have parity with the public school teachers. So it's a pretty significant bump no matter where you are. And certainly if you have your credential, your trajectory is going to be that much higher. I will say we are challenged by, we're now looking at a potential pay scale for program directors, which is complicated in its own right. But because there is no parity population, there's not a perfect equivalent in the public school system for directors. And so I think this is going to be a lot more complicated than even the teacher pay scale was to develop.
Because the minimum is that was done in the original bonuses was on the old schedule, and then in October DC renewed with this big jump to 75. And in we did have in the direct payments, and we will have in the payroll formula, family childcare as well. So we just want to be clear that we're not just center-based in all of these places. Just to wrap it up before we go to audience questions, is there something that you didn't expect, and how did you deal with it, and what's its impact be that other people should be aware of? And it can be everything from how you did the input from the field to how other policymakers responded to, gee, that turned out to be a dud. Avoid that. Or this turned out to be fabulous.
Mhm.
I'd like to lift two things, lessons learned, maybe three. The first is, and I saw this question in the chat, the benefits cliff is real. And
There you
you're
go.
adding a
Yes.
significant amount of money to people's income. And so we were able to write into law to protect the benefits cliff for some, if they were a DC resident. But because we are in a metropolitan area, we have many employees of DC Early Learning Programs who actually live in Maryland and Virginia. And so they were not exempt. So we had to do a lot of education. We partnered with community-based groups to try to educate and inform teachers of what any implications would be. But the exemptions were really key and important, and we would do it all over again. Taxes. If we could do it all over again, we would urge our state agency to find a vendor that could take taxes out and do the withdrawal, perhaps even maybe use a payroll company. The vendor was not able to withdraw any federal, we exempted state taxes, and it became very complicated earlier this year when teachers went to file their taxes. So extraordinarily complicated. We wound up having to course correct a few things with the vendor, but we would do that all over again. And so as we talk to our colleagues across the country, we hope that folks are really taking into account the amount of education that really needs to be done with direct cash payments. And then the third is really about communication. And this sort of goes along with data. We actually did not have a lot of data about our teachers. We had so much more data on actual providers, but we started from scratch. The state agency didn't have an understanding of who had their credentials, and there wasn't a lot of enforcement to update the systems. So of course now that's in place, and it is now required for providers to update that information for each of their employees and certainly each of their teachers. When the permanent program rolls out, the state agency will actually be requesting payroll data from every employee, so that from every provider to show what the increase is for each teacher. So that is going to provide a lot more data, I think, than we've ever had specifically around salaries. But the communication mechanism, I think rumor got out far ahead of fact. And so I would say even now as the state agency is rolling out the permanent program, we are advocating for far more info sessions, public comment periods, because there are so many more questions than I think they're able to answer at this point. So communication is key so that rumor doesn't win the day. And we want teachers to feel confident that this pay raise is coming. We want them to be, I think, clear and confident about where they fit on that scale and what their opportunities are for an upward trajectory. And so again, just all of that has to be communicated out on a regular basis and with some real clarity.
Right. One thing that was vexing for me, and Kim, I don't know how you dealt with this, but we had so many centers who needed so much help, but we have a lot of wealthy suburbs, and there were programs and change that were still making a big profit. And we were sending them some of our valuable resources to pay their teachers instead of them using profits to pay teachers. So they were making more profits as we were helping that way. And we could not figure out a way around it because the majority programs were still struggling. And in terms of keeping it simple and not making a big application, that's something I struggle with as we look at these wage support kind of programs. That's a little different than what Kim was talking about. But Kim said a couple of things that make me off script on what I thought I would say here. One is that you cannot communicate enough. And really, it really helped us in Connecticut to have these independent communication. Every Monday, our advocacy community has a call with 200 to 300 providers. And they also have a listserv. And so they have us on and they're in charge and we're answering their questions. We have to think about our power in the system and making sure that we're putting ourselves out there and being heard. So there's real value in another group. And also SEIU organizes our family childcare providers, and they're a tremendous partner. I know there are other states who are worried about that, but for us, like when we negotiate with them, like we had a tremendous increase over the next 3 years, and they wouldn't settle until they also had their professional development goals met. They want to be part of improving the system, and they're wonderful communicators with their union. So it might be an alliance of advocates, it might be a union, but you can't be the only one communicating, and you really need to be open to their questions and going to them. I would say I was really surprised. I mean, the stabilization funds were some money, and it was significant in some cases, but really not more than a month or two of expenses. What a difference that bonus made to help programs survive. And Connecticut actually increased its capacity over the 3 years before the pandemic. And I truly believe it's the family childcare providers who were able to hold on where we were losing them at too quick a rate and losing that capacity, that giving that these programs are so scrappy and they're survivors. And if you give them funding, for the most part, they're going to make very good use of it. So I guess I was surprised by that. And on the taxes thing, Kim, we went through the program, so we didn't have that problem. But I will say the family childcare providers still had that problem because they are the business. So they got the checks. And there's a real lack of understanding about taxes. You know, people, well, if you give me $1,700, I'll have to pay taxes on it. It's like, yes, the money's actually coming from taxes to pay you, but you will have to pay taxes on it. And so I think there needs to be just a broader understanding that when you make money, you will be taxed, and taxes help support our system, you know, as a system. I just think just in our culture today, all taxes are bad somehow, but you know, many folks on this call have been advocating for it, and you've heard us talk about, you know, you increase. Our governor's question is, what's the impact on the taxpayers when we say, oh, let's keep the 70 million in the budget and increase rates permanently? He knows that means 70 million more a year forever. But so we've got to, I think we need some education around that tax piece. But you cannot communicate enough, and you cannot be respectful enough, because you have to remember how much power the state agency has, and that providers are really hurting.
Wow. I just have to say, I'm awed by the two of you, and the kind of work that this is doing is really transformative for the field. And the fact that it's not one-offs and you're thinking forward, and you've gotten all the political players together in your great coalition. So I just want to thank you so much for what you're doing and being able to share it as well. I'm going to turn now back to David, who's going to help us with audience questions that have come up through the chat and elsewhere. So David, you're next.
Yes, I am back, and we have about 10 minutes or so for questions. Fortunately, Kim and Beth's amazing Connecticut team have been multitasking and answering some of them, so that helps keep us on time. But the first question I think is for Dina, and Dina, I don't know if you want to get back on camera. So the question relates to, you showed some data showing that there is fairly significant wage growth for EC workers, but then you also showed that a lot of them, the majority, don't stay in the field or the same occupation. And the question is the implication that childcare workers have low starting wages and have to leave the field to realize their wage growth.
Yeah, and that's a really excellent question. And one of the things we did look at was we compared workers who left the field to workers who stayed in the field, and what did their wages look like 10 years later. And those who left the field were making slightly more, but it wasn't statistically significant. You know, with my researcher hat, we, wouldn't necessarily call it a difference, but that is where the trend is. I think it really points to how interesting and exciting and useful it would be to have data that could really trace out particularly which jobs they went to with, workers if they did stay in early care and education, and hearing Kim and Beth talk and about, all their policy innovations. But then the part that I get super excited about is that they're building in ways to really understand how this is impacting workers in the long term. And then you could answer questions better, I think, about how whether workers who are staying in the field, whether they see wage increases, when they see wage increases, both as a result of these specific policy actions, but just, over time in the labor market. And then with other sources of data, you could compare that to leavers, people who leave the field, and maybe see, what could help support retention.
Great, thanks, Dina. And just to kind of build off that, we did have a question that Kim, you answered, and you can certainly expand on it. And Beth, definitely weigh in. And that is on, how are you measuring whether these efforts are being successful? And we heard, that partially you're measuring, are the funds getting into the pockets of the teachers? But beyond that, how are you thinking about whether this is impacting the ability to find qualified workers and to retain workers? Is that something you're looking at to measure?
Well, I would just say that Connecticut can't really compare to DC because of the progress they've made on wages permanently, getting into that teacher zone of wages. But at some level, I've just come back from a seminar with early educators from around the world, really. And it's really fascinating. The conversation is moving from, does this matter, to, we know this matters. How do we make it better? And so I think our sort of outcomes orientation and go as a nation, it really helped me to be around other leaders from around the world. Even Germany, they tend to be more like us in that way. But that we need to get past, like, does this make a difference? We know that wages make a difference, and how do we get there? But at the same time, one of my takeaways that I didn't say from this work is that the problem is so huge. The workforce problem in early childhood education, we need a decade. In Scotland, it's taken them they have a plan, and in Germany, they have a plan, a very long-term plan, because they know all these countries are adding early childhood and their workforce problems around the world. But in the US, we have to go back to high school and start it in high school. We're looking at, in Connecticut, could we make child development a science class and count as one of the 4 sciences, just to get more people engaged, have them have the lab at the lab school and learn child development. We are at least a decade away from having the workforce we need. And the current crisis is huge. And we're going to need some scaffolding and temporary measures for the next 5 to 10 years to hold it together as we build the long-term solutions. Because even with all these funds out there, it's like SOS, it's not building a system. And so we need to look at examples beyond other states and look international at countries that are doing this long-term planning.
Amen, Sister Beth. Amen to all of that. I will add that it's still so soon to tell. I mean, what we know anecdotally from providers is that there has been a slowing of teachers leaving.
Oh, good. Yeah.
Because now we have had 9 or 10 months of the direct cash payments, and word got out pretty quickly. So that's helpful, but again, some solid data would be helpful. Now, what we anticipate is that when the permanent program begins and teachers are seeing the increase in their paychecks every other week, we think and we hope that that is going to further motivate them to stay, and word gets out. We live, though, as I mentioned before, in a tri-state, in a region. And so what I'm concerned about is the pull from Virginia and Maryland. I am fearful that teachers in those states will want to work in DC because the pay is higher, because they would get benefits, and then it would gut those systems. So we have begun
Oh,
more
interesting.
strategic regional conversations
Mm.
to say, what can we do to speed this progress up in Maryland and in Virginia? And are there any initiatives we can do collectively to keep an eye on our workforce and really evaluate what's happening as we all continue to build out our systems to be as equitable as possible?
Great, thank you. So we have a question here. Curious how DC and Connecticut define quality with a focus on equity and inclusivity, how you determined how to pay providers for various quality elements, such as family engagement, healing-centered practices, cultural responsiveness, supports for children with disabilities, etc.
Yeah.
And what this process was like.
Well, I'm going to make it really simple. We do not have a quality rating and improvement system in Connecticut, and we fought it. And now we have what we call a quality improvement system, where our standard is accreditation, NAFCC accreditation for family childcare, Head Start standards, or NAEYC accreditation. And rather than have raters, we've put supports and professional development out in the field for programs to reach accreditation. But I know for some folks, they worry that that's not expansive enough, and it's not. And again, around the world, we're sort of struggling with how do we define quality. And so in Connecticut, we've chosen to pick a national standard, whether it's Head Start, NAYC, or NAFCC, so that we can use our resources supporting progress toward that standard, and then leaning in on items like this to reward that standard. We do also pay a 25% accreditation bonus for any program that is accredited on their subsidy. Then we started that during the pandemic, but that will continue in perpetuity. Governor Lamont has seen good success with that, and that will continue with that 25% bonus but we are using a standard that's not perfect. There's no perfect standard, but both those three measures are accepted quality standards.
And in DC, we're still working on it. We do have a quality rating system, but probably most people agree it's not what we want it to be, and it needs to be reimagined. And so there are some efforts there. Part of actually credentialing requirements were part of the strategy to improve quality years ago. And then they are just now starting to take effect. For instance, credentialing requirements for program directors went into effect as of December of 2022, and it goes into effect for assistant teachers and lead teachers later this year. So we believe that that is, part of an overall strategy, but quality is always, always, always the elephant in the room, and we are continuing to work on it.
Great, thank you. We have time for maybe one or two more. Someone asked, I'd love to hear more about the healthcare evaluation component of the work. When will that work start and who's doing it?
That's still being negotiated. Hopefully we'll be able to share more soon. As I noted, our healthcare program is for all early learning employees. It just got off the ground and started January 1 So they did a big outreach and push at the end of 2022. The take-up rate's been pretty slow, but I think there are nearly 100 providers enrolled right now. But we'll be able to share more on who will be evaluating that program and exactly what they'll be looking at. And the same with the compensation program. I do know Urban Institute is working with the state agency on evaluating some parts of the compensation program, but I don't have all the specifics.
Kim, that'll be great because I think all the states are struggling with that. And I know I'm embarrassed how few early childhood educators have health care. It's like a basic human right. So I think we have to do better. So can't wait to hear.
It's hard. And another area where over communication is key. A lot of health literacy, like just insurance literacy, is needed. We're finding it's not just as easy as putting out word that it's available and the droves will come. That is not what's happening. We're having to do a lot of one-on-one conversations, in-depth conversations and interviews. It's really interesting. Yeah, it'll be a great case study.
Great.
Well, great. I think that concludes our questions. I think we got to most of them. If we could go to the next slide, please, Lauren. So we have one more poll question for you, and we're going to drop it into the chat again. And as I mentioned before, we just scratched the surface. Wish we could do 2 more hours of this, but we do want to know what else you would want to learn, what topics related to the EC workforce. They could be more general or specific to compensation strategies. Do you want to learn more about that would make the biggest difference in your work? You can type in a short phrase or a short sentence. Again, the link is there in the chat. Just open your browser, it'll take you to Slido and you can just type something in. We do want to bring more learning opportunities to you like this, so we want to know kind of what you're interested in learning more about. I'll give you about a minute or so. About 10 more seconds. You can keep typing while we continue the presentation too. We really want to get your ideas down. Okay, I think people are done. These are some really great ideas. I'm not going to go through them because we don't have time, but we have them down and we're going to look at them closely and see what other opportunities we have for more learning. If we could go to the next slide here. So where can you find more information about these topics? We have resources here. If we can go to the next slide. So we have resources from APT here, and Lauren's going to be dropping these links into the chat as I go. So you can pick them up there. As I mentioned, this PowerPoint will be made available to all who registered, so you can access the links at that time as well. At the top here is the dashboard that Dina talked about. We provided that link earlier, as well as several other publications related to career pathways and specifically early childhood workforce. We also at the bottom, please join our mailing list at APT. That's how you learn about publications, new learning opportunities like the one you're attending today. Next slide. So here are the resources from Kim's group in DC, including some of the things that people were asking about, inquiring about in the chat. So those are getting pasted into the chat, and the next slide has the Connecticut resources as well, including the proposed wage schedule. I think someone asked about that. So those are going in the chat as well. And then our final slide here is just thank you. I really want to thank my co-presenters, Adele and Dina, and particularly our guest presenters for taking the time, Kim and Beth. We really appreciate it. As I said before, I wish we had another couple hours to listen to you speak, but we don't, sadly. So thanks everyone for attending. If you have any questions or need help on anything, here's some emails of our app team. You can contact us at any time. I hope everybody has a great rest of the afternoon. And again, thanks for joining us. Take care.